Good morning, everybody. Good morning. I'd like to welcome you to the Healthy Futures Summit. My name is Kumi Smith. I am an assistant professor in the Division of Epidemiology and Community Health in the School of Public Health. I will be your MC today, so I will be up here sort of introducing all of our speakers and navigating us through the day. This is a very incredible gathering of attendees from across many sectors. We have students, faculty, alumni, practitioners, and community members joining us here today. We've had over 400 registrants for this event, so we're very excited about the enthusiasm and interest today. Before we begin, I first want to acknowledge that the University of Minnesota, Twin Cities, is built within the traditional homelands of the Dakota people. It is important to acknowledge that the people on whose land we live, learn, and work as we seek to improve and strengthen our relations with our tribal nations. We also acknowledge that words are not enough. We must ensure that our institution provides support, resources, and programs that increase access to all aspects of higher education for American Indian students, faculty, and community members. So now I'd like to introduce Dr. John Finnegan, who has served as Dean of the School of Public Health for the past 15 years. He's been a tireless advocate in advancing the school as a leader in research, education, and community-engaged partnerships, and also in preparing all of us to better face the health challenges looking ahead and into our healthy futures. Please join me in welcoming Dean John Finnegan to the stage.
Thank you, Kumi, for the introduction and also for helping us honor the original people that came to this land. This is amazing. Let's see, what time is it now? So it's a little bit after 8. I assume that you've all milked the cows and fed the chickens and all those good things. Clearly, you must all be farm folk, right? Because you're up bright and early, and here we are, ready to go for a hard day of learning and discovery and robust discussion. I just can't thank you all enough for coming to this event at this time of the day. And as you know, it's going to get even better as we go along. We have so many other events and discussions that are planned. This is our first ever Healthy Futures Summit. And as you probably know, we are celebrating the school's 75 years of transforming public health, even though public health has actually been taught at this university for almost 150 years. That's astonishing. It was here really from the beginning, the first president of this university. The school has combined science, discovery, and dedication to mission, and it's in fellowship with all of you to build a healthier future for everyone. So today is a day of discourse and learning, and tonight is our evening, our gala of friendship and a celebration that many of you here today will also be joining. It will be a long day, but a glorious day, I assure you. Public health is and always will be essential to prevent disease and injury and to promote health and wellness in whole communities and populations. And we respond through research, education, and partnership to the public health challenges that face us today, yet we also seek to peer over the horizon as far as we are able, anticipating how our science and learning may shape the health of populations and communities well into the future. This is the critical obligation of our land-grant university mission to our state, to our nation, and all the partners with whom we collaborate here at home and around the world. They say it takes a village to raise a child. I tell you, it takes an entire population to focus and raise public health to the status that it should be. The conditions for health and wellness, we believe, are a human right. And every day we shape our research and our learning to help, with your help, to achieve that vision. So today we're bringing together scholars and professionals and leaders and community members for conversations about the future that we can choose. We're not simply tossed on the ocean waves. We can choose what kind of future that we want. So I want to thank you all for joining us, and as Kumi mentioned, more than 400 of us are gathered here in person. Many more will join us online because we're streaming this live at certain portions during the day. So that means we have to behave ourselves, I think, in some way. We hope that you will leave with innovative ideas. We hope you'll leave with innovative solutions and that you may apply to your own work toward building a healthier future. In October of this year, I attended the World Health Summit, which is held annually in Berlin. And it's an annual event where thousands of decision makers and students and professionals get together. They exchange ideas, they think globally, they focus on the health challenges that are facing all of us, and you will not be surprised that climate change pops up again and again. Yes, even the medical community has discovered climate change and the importance of that to the health of their patients and populations. Today, we will address that far-reaching threat to human and planetary health, along with several other topics, including the unprecedented aging of the global population, the anti-science movement, and persistent structural racism in our society. We're going to start the day by hearing a few words from one of our state's leading health visionaries, and that, of course, is Minnesota Commissioner of Health, Jan Malcolm. Minnesota has one of the most progressive health departments in the nation, and Commissioner Malcolm is a driving force in advancing that legacy. She has served as commissioner in the administrations of 3 governors, Jesse Ventura, Mark Dayton, and now Governor Tim Walz. She's also been adjunct faculty here, where she co-directed a national research and leadership development program funded by the Robert Wood Johnson Foundation. And throughout her career, Jan Malcolm has been active in state and national health care, public health associations, and government commissions on healthcare access and quality. I am proud to call her a colleague and a friend. Please give a warm welcome to Commissioner Jan Malcolm.
Thank you, John. What a lovely welcome. Good morning, everyone. It's just great to be in this room with so many friends. I've gotten some soul-filling hugs this morning, so thank you for that. And first, let me say congratulations to the school, Dean Finnegan, to you personally, for this celebration. And what a great way to honor the mission of the school, but to use the occasion of your celebrations to bring us all together and challenge us to keep moving forward. I am very, very proud of so much that we do here in Minnesota, but I also want to challenge us, as I think the Dean has and will continue to do, to not be satisfied with our relatively good performance as a state on health measures. I think we all know the data. We've actually known the data for quite a long time, but we're now acting on it in more systemic ways to make sure that we don't just measure our success by the averages. You know, Minnesota's been great on average for a long time, still is. Not nearly enough. We have to now not only understand as we do, but act on the understandings that we have of how uneven, how structurally inequitable access to the opportunity that creates health really is. And so I so appreciate Kumi's opening and the acknowledgement of the Native people whose land this is. The health disparities facing the Native nations are stunning. I mean, I've known these numbers for a long time, and I still can't get my head around the depth of the barriers to health facing so many in our state around racial and ethnic lines, income lines, geographic lines, age, disability, you name it. I mean, the big sea change, I think, from going to thinking that public health's job is to move the needle on average to public health's job is to eliminate the structural barriers that keep people from achieving their optimal possible health is just a fundamentally more inspiring and more difficult challenge for us. But I think we're up to it. I won't, they said I had 5 minutes to talk about the future of public health, which, everybody in my office just laughed when they heard that. So John, you have the hook, you have permission, but I really, truly am going to be really brief and not tell you all the data that you probably already know about where we're doing really well as a state, many measures, but again, really only on average, every single measure you can find, there's some inequity that needs to be dealt with, needs to be acknowledged, and needs to be acted on. But we do have actually a lot of strength in Minnesota and a lot to be proud of historically. I had the chance yesterday, it was another amazing day for public health in Minnesota yesterday. I had the privilege of standing with Attorney General Ellison and Governor Walz, a whole bunch of brilliant kids, when the Attorney General announced that he has filed a lawsuit against Juul on building very squarely on the legacy set by Attorney General Humphrey, Blue Cross Blue Shield of Minnesota, when we, as a community, really grabbed what at the time was a daunting prospect of actually taking on big tobacco legally and winning. And I literally had goosebumps yesterday listening to Attorney General Ellison and Governor Walz talking about that legacy and the consistency of Attorney General Ellison now using all the legal tools in his toolbook to hold Juul accountable for the deceptive marketing practices that have, just in the last several years, you guys I hope have all seen the Minnesota student data, in a few years, the rise of vaping and e-cigarette use has totally wiped out a decade of progress in reducing youth smoking of conventional tobacco products. We have reached historic lows for youth smoking of traditional cigarettes. Not true in all communities, again, it's that average problem. But for the first time, the meteoric rise in e-cigarette use completely overshadowed that gain. And we now have a quarter of our kids in 11th grade self-reporting on the Minnesota Student Survey that they are regular vapors. And everybody I know, every kid I've ever talked to, every teacher says, yeah, that number, multiply that by about 3. It feels like everybody's doing it. And we know that a large part of the reason people are doing it, kids are doing it, is because they perceive it as safe. 3/4 of those who say they are regular users say they don't believe there's any particular danger to it. They don't know what is in the products that they're consuming. So I could go on and on just about this, but what was cool about that event yesterday was once again, seeing the state really, looking seriously at all the tools in the toolbox and being willing to apply them. And it really, hearkened me back to those early days after the tobacco settlement and what we were able to do with the tobacco settlement resources here in Minnesota, because we had our act together as a community. We had the CDC blueprint that gave us evidence-based strategies of what it took in total to mount a really successful effort in tobacco cessation and prevention. We not only had that blueprint, we had a community that was working together to figure out what's everybody's role. What's the best thing that the health plans can do? What has to be happening in every physician's room? What is the role of state and local public health? What is the role of the nonprofits? What is the role of the University of Minnesota? We had not only a playbook, but a community effort where we certainly understood we were all in it together, and we figured out to a great deal of specificity who was going to do what. We really acted as a system, and we were able to put those resources to use in absolutely record time to build a really comprehensive youth tobacco prevention initiative across the state. It was, at the time, maybe still is, the single most rigorously evaluated effort we've ever done, thanks to the School of Public Health. So what I'd like to do is just have us remember that, reflect on how powerful that was and what it took, and challenge us to really get back to thinking as a system, as a public health system, which is all of us. the healthcare providers, the health plans, the purchasers, the consumers, the scholars, the governmental public health practitioners, our community-based organizations. And I'm so optimistic, because think of what we know now that we didn't know 20 years ago. The richness of the discussion around social determinants, the willingness to embrace things like structural racism. Maybe we're still struggling with figuring out how to apply what we know. But it's not that we don't know what to do, what needs to be done. It's a matter of really marshaling that community will to do it. So I've spent my entire career just about as part of the health system in Minnesota. I've had the great privilege of working at the Robert Wood Johnson for a couple of years, but this has always been home. I want to, again, thank the university for its partnership. I am so proud to see my IRL family here, many of them. The Interdisciplinary Research Leaders Program, I think you'll hear about it a little bit today, is one of those efforts, I think, to help bridge the worlds of scholarship, research, academia, and community action. It's not enough to produce the knowledge. We have to be part of applying the knowledge and actually making change with what we know. And when it comes to facing these big health challenges that you're going to talk about today, it is going to take us really, really thinking as a system, not, well, MDH is doing great, but local public health's falling apart, or if only local public health could get more of the funding it deserves, then that would be fine, regardless of whether the state Department of Health has the resources that it needs to stay on top of the emerging issues. We think too much separately, and Dean Finnegan and I have had some conversations that are always like, somehow, some way, we've got to figure out strategically how to make better collective use of the assets of the School of Public Health, the Minnesota Department of Health, local departments of health, and our community partners. The health systems, the health plans, whose missions and whose legal obligations compel us all to work together on population health. But we talk a better game of collaboration than we practice, in my humble opinion. So I think it's time for us to challenge ourselves about really taking a look at how we best work together, who's in the best position to do what, how do we better leverage our collective resources and stop competing against each other for those all too marginal dollars that are invested in prevention. For all that we know, for as important as we should be to the health policy debate in this state, much less this country, we should be really pretty frustrated that we're not more central to this debate. And we got to figure out how to change that, how to become more in the middle of this health policy conversation. What I need to do, like literally right now, is head down the freeway to go co-chair with Commissioner Jody Harpstead at Human Services something called the Blue Ribbon Commission to Transform Health and Human Services. I can pretty much promise you we're not going to succeed in transforming health and human services, but we're going to try to elevate some of those bigger picture, longer term issues that we don't think that the state is focusing on with nearly enough rigor. And I'm really quite sure that a big part of the answer is figuring out how we lift our eyes up several levels to look at the system as a whole and to figure out how we can best leverage each other's strengths. I think you're going to have a fun day. I really wish I could be here to listen and learn, but I am so grateful for what you all do and for this event, and I wish you a great day and see you soon. Thank you.